Good morning and welcome to your weekly cup of Joe. My name is Joe King. I'm the owner of Physical Therapy Advantage, and we're continuing our talks on post-surgical tips. This week we are talking about total hip replacements. Most total hip replacements nowadays, most surgeons are using an anterior approach, but not all, but a lot of them are using an anterior approach. It seems to work a little easier, less tissues and that are damaged during it, easier recovery, the whole 9 yards. First and foremost, you want to make sure that you know what your doctor's movement and or their protocol, I should say, is, and their movement or lifting restrictions might be. A lot of times with anterior approaches on total hip replacements, you can't do active hip extension. So basically kicking your leg backwards behind your body. You can't actively do that. You passively might be able to do a little bit as the time goes on and things get loosened up. But at least for the first 6 to 8, maybe even 12 weeks, depending on what they say, you can't do any active hip extension. As we've talked about before, taking your medications. You want to make sure you're taking your medications and staying on top of pain and making sure that you're not having any major pain episodes and you're controlling it so you can sleep, you can function throughout the day. You want to make sure when you are walking, and you should be able to walk pretty easily, whether you're using a walker, whether you're using a cane, post-surgically, that you want to make sure your foot is pointed straight forward or maybe just slightly outward. So a little forward, or make sure it's forward or slightly outward a little bit. You don't want to be walking like a duck, and you definitely don't want to be walking like a pigeon-toed and walking with your toes turned in. So really be careful as how you're walking afterwards, and really start to train that leg to walk accordingly and appropriately. When you're going up and down stairs, go ahead and use the railings. You're not considered to be cheating when you're going up and down stairs post-surgically. And you want to go up with your good leg first. So you go up with your non-surgical leg first. And as you're coming down the stairs, you go down the stairs with your bad leg or your surgical leg. So up with the good, down with the bad, up with this, your non-surgical leg, and down with your surgical leg first. And if, as we've talked about before too, you can use ice on the area to help with pain and with swelling if you need to as well. If you have any other questions about these tips, which will be in the box below, please don't hesitate to give us a call at 630-892-8003. That's 630-892-8003. We look forward to seeing you next week for your weekly cup of Joe. Bye.